Hi, my name is Kafuide. You're watching GTV Breakfast. And what happens when your face stops smiling? We're having a conversation on understanding facial paralysis. And I have with me Dr. Kofi Boahene. He's a facial, plastic, and reconstructive surgeon. Break that down for my 15-year-old son. What does that mean? What do you do?
Well, we're talking about the face. And so when people think about plastic surgery, the first thing is plastic. It's not. Plastic means something that has plasticities. You have the ability to change it, to mold it.
Okay.
So when you say you're a plastic surgeon, you're able to take a tissue and then change it around, move it, to make it work the way you want it to work, look the way you want it to look. So facial plastic reconstructive surgery means, for me, anything above the collarbone up to your brain, to the hair. Okay. If anything is a mess, we can sort of move it around. So that's my specialty.
Okay. Let's zero into facial paralysis.
Okay.
What is it and how does it occur?
You know, the thing that distinguishes humans from other creatures is our face. When you wake up in the morning, you look in the mirror, your face stares back to you, you recognize yourself, you know who you are, then you charge to fit the day confidently. But something happens to your face, you lose confidence, you don't know who you are, you become depressed. Paralysis is a form that the muscle doesn't move. And for various reasons, if the muscles on the face that we speak with, we blink with, we wink with, we smile with, if they become paralyzed, then you have facial paralysis. Now, it's got functional problems. For example, if you can't close your eyes, you can lose your vision.
You
could
have
lose
cases
your
of people
vision.
who can't close their eyes?
Yes, with the paralysis.
Oh, wow.
If you have paralysis on one side, the muscles that open up. If you've seen somebody who's running 100 meters, their nostrils starts dilating.
Yes.
There are muscles that do that. So if you have paralysis, that muscle cannot move, so you can't breathe on that side. To eat, you have to be able to purse your lips, speak, make what sounds that we call plosive sounds. So if you can't move your lips when you're eating, the food just comes out. When you're speaking, people can hear you or understand you very well. And more importantly, the facial cue that has the most value is to be able to smile.
Yes.
Right? So if you can't smile, the world feels that you're angry, your children feel you're angry, and then you pay a big societal penalty for it. So that's facial paralysis in the gist.
I must imagine that it must cause a lot of psychological issues for people who are undergoing that problem.
Absolutely, absolutely. I have worked with multi-billionaires who cry and weep in my office like children because they think their identity is gone, right? They can't go out in public and eat because they always have to wipe their mouth. They can speak clearly on the phone because people can't understand them. And so they become reserved, inward-looking, and with that comes depression. So there is a lot of psychological penalty with facial paralysis.
How does it occur?
So for a paralysis to happen, there are various reasons. So one category is what we call the congenital cause for facial paralysis. Congenital means you were born that way. You were born that way because something went amiss. The nerves that were supposed to help you move didn't get to where they are, or the muscles that move the face didn't develop well. So as soon as you're born, you have your first cry, the obstetrician can tell there's something wrong. So that's congenital. In some people, during delivery, they were developed fine, but when they were being delivered, they get stuck. The head maybe got stuck. So we do something we call forceps delivery. The obstetrician uses an instrument to hold the head and pull the baby out. If they are not careful, that instrument can crush the nerve and cause paralysis. But by far, the most common reason for somebody to have a facial paralysis is through no fault of anyone. They are fine, their faces move, they wake up one morning, the face is gone.
Just like that?
Just like that.
Like a switch?
It's like a switch. It's called Bell's palsy.
Okay.
Bell's palsy. So someone would tell me I was fine, I went to a dentist, I came home, I was a little bit stressed. I woke up to brush my teeth. I saw that I can't keep the toothpaste in my mouth. I look in the mirror, my face is not moving. I'm thinking I have a stroke. So they rush to the emergency room. In some people, they are changing jobs. Any stressful situation. Pregnant women in the last trimester of their pregnancy tend to get this a lot.
So it's stress-induced?
Stress We know the underlying cause. The underlying cause is a virus that all of us have. But the viruses are dormant in the nerves. But stressful situation can activate.
So it kind of wakes it up.
It just wakes it up, and then quickly the nerve is gone. The good thing is that for that type of paralysis, unlike somebody born with that problem, it tends to recover on its own in about 70% of the people.
Okay.
The remaining 30% it doesn't. And those are the ones that we offer some type of care.
What are the most common causes of, how common is facial paralysis in Ghana? Which are the most common types?
So I can tell you the statistics in Ghana because I didn't train here and practice here, but I can tell you in the US, and if it's so in the US, it's probably universal. In the US, Bell's palsy, which is the most common cause, happens to 40 people in 100,000. Okay. So it's rare, but not zero. Okay. In Ghana, the same incidents probably exist. But what I'm finding out is that there's another cause of paralysis where you have a tumor or a cancer growing on your face. And usually you have to go take the tumor out. But the thing that makes it challenging is there's a nerve that moves your face. So if you don't get an experienced surgeon who can take the tumor without injuring the nerve, you will get a facial paralysis. So I'm seeing people who have had that surgery and the nerves were cut and they think there's nothing that can be done, but there is something that can be done for them.
What's the difference between Bell's palsy and somebody who is suffering like a stroke, paralysis caused by a stroke, or maybe paralysis caused by an injury?
Okay, so Bell's palsy is rapid onset.
Boom.
Yes.
Okay.
I slept, I woke up, my face is not moving. I can't think of what happened. Maybe I had a cold the night before and I just got it.
But that could also be like a stroke.
But that could be like a stroke. So everybody who gets Bell's palsy rushes to the emergency room, and they should. Right? Because if we can make a difference, really in the first 24 hours is critical. But once you get to the emergency room, that's when a physician can tell the difference between a stroke. If you have a stroke, usually means there's an arterial problem in your brain. It will not pick only your face. It will get your face, your hand, your leg, or something.
One side. Probably.
Yes. Now you can get a stroke that can affect one half of the face, but when it does, usually it's from the brow to your chin, half the face. It will spare the forehead. So if I see somebody with a stroke that they can raise their forehead and this down is paralyzed, I will suspect a stroke if there's anything, nothing else. But if it's purely half of the face and nothing else, usually not a stroke. But in emergency room, once they do an exam, they look and everything is fine except for the face, then they will tell you Bell's palsy. If they are concerned, they will get a CT scan or an MRI to rule out a stroke. Okay. So when you have something like this, you don't sit at home and hope that it gets better. You need to be seen right away. Yes.
How about facial paralysis caused by an injury?
So there are two forms of injury that can cause it commonly. Traumatic injury in car accidents, right? So the bone in which the nerve runs sits right behind our ear. So if you have a car accident and you hit your head and the fracture goes through that bone, it can sever the nerve. And so that is one of the things that when you see somebody through a trauma in a car accident, we check for these things. The other injury most commonly is what we call iatrogenic. It happens during surgery. Somebody was going to take a tumor out and then they cut the nerve. They can cut the nerve by mistake, or they can cut the nerve purposefully if the cancer is going into the nerve.
Okay.
Yeah.
All right. You probably hinted at it, but what are the typical signs and symptoms one should look out for facial paralysis?
Okay, so there are some, when it's so quick and obvious, you can't miss it, right? When it's so slow, insidious, that's the one that gets people, right? If you told me, a month ago, I couldn't raise my eyebrow, and then 2 months later, I can't close my eyes. 3 months later, my speech is a little bit slurred, that is not Bell's palsy. And I've had experienced doctors misdiagnose that as Bell's palsy. Bell's palsy happens really quick.
Very rapid, okay.
If it's a gradual, progressive loss of movement in the face, it tells you there's something slowly pushing on the nerve that moves the face or growing into the nerve that moves the face. So what should you look out for? If you have twitching on your face, then spasm that won't go away, and then weakness, you should seek care. That is a sign that there's something growing and pushing on the nerve.
Okay, so those spasms are key.
Yes, spasm, everybody will get
Once
a
in a while,
spasm
you get a
every
tick or
yes.
something, yeah.
But a persistent spasm is a tip-off.
Okay.
Yeah.
How do you diagnose facial paralysis?
Most commonly is by a history. You talk to you, then I can sort it out what is causing, what type of facial paralysis you have, and then an exam. If you are unsure the cause of the paralysis is obvious. Your face is not moving, but you want to look for the underlying cause. And if you do an exam and you can tell, you confirm your suspicion with an imaging study, a CT scan or an MRI. So that's how we diagnose it.
Okay. Is it like a permanent condition? Are there some cases that cannot be treated?
So that's why a place like our institution exists. It's almost every form of facial paralysis we can do something about it. But the key to the best result is to seek care in a timely fashion, because time is muscle. People say time is money. In your face, time is muscle. The longer you've had paralysis, the muscle slowly whittles away, and after a while, it becomes fibrotic, like a scar, and you cannot get that muscle to move again, regardless of what you do. So if you come to see me and say, I have had paralysis and it's complete, and it's 20 years old, or 5 years old, or even 2 years old, that muscle is irreversibly gone.
What is the window of time?
Window of time, you have like 6 months to have something done. 9 months if we are pushing it, to have those muscles reversed.
Okay.
Yeah. It's not like if you come 20 years after the fact, we can't do anything. We can. In those cases, we have to go and transplant the new muscle to replace the old muscle.
You can transplant muscles?
We can do
From
that.
where?
Yeah. From the various spare parts. You know?
Dr. Wayne.
Yeah, we have spare parts. So I see you've had your legs crossed.
Yes.
If I cross my leg, there's a muscle in the inner thigh.
Yes.
We call the gracilis muscle. Right? It's as long as a belt.
Okay.
We can go take a piece of it and then use it to replace and
A piece of my own muscle or somebody else's
your
muscle?
own muscle.
My own muscle.
And we can transplant it too.
So I have my spare parts inside of me.
Spare parts.
Nice
spare
one.
parts.
Good to know. Swami magazine or Kokompe.
Yes.
Listen, so now how do you diagnose? I'm sorry, you've diagnosed. How do you treat
it?
Facial paralysis?
So again, the information is you get paralysis, see somebody quickly.
Okay.
Okay. If it's the Bell's palsy kind, the first thing we do is once we know it's not a stroke, we want the virus to calm down pretty quickly. So we give you an antiviral medication. The antiviral medication is not a critical treatment. The nerve swells, and that's why it stops working. So we give you steroid. It's very effective if you do it quickly.
What does the steroid do?
It minimizes the inflammation or swelling around the nerve and allows it to calm down. So the nerve runs in the bony channel. The nerve runs in the bony channel. So if it swells, it gets to the point there's no room.
There's no space, yeah.
It just squeezes it, so the electricity doesn't go across it. So the steroid shrinks it down to back to normal. Okay. So that's medication, right? If we think you have Bell's palsy that you can recover, then we add physical therapy, because the brain is very plastic, right? It has the ability to repair itself. So we use physical therapy to tell the brain, this is what's happening on the face, try to help it out so that it recovers.
So how would you do that? What would be that kind of therapy?
They give you muscle strengthening therapy. And there are some therapies that you help strengthen the muscles in the face.
How would you? I mean, I know for hands I could do this. But would I have to do some?
Those things, and then these things, yes. And then they have electrical stimulation. And I want to make a point about that.
You're going to shock me?
You can shock. We can shock muscles, right? As long as the muscle is moving, it's like a workout.
Okay.
We do that on body muscles, leg muscles, but not on the face.
Why not?
If you do that, the nerves will get confused. The muscles on the face are very, very delicate. They can make multiple expressions. So if you give gross electrical stimulation to it, you are not doing fine treatment. And so you get something we call synkinesis. I want to smile and my eye closes. Ooh. I want to wink and the corner of your mouth moves. Okay. So I don't recommend facial exercises with electrical stimulation.
Okay. So just the face movement.
Face movement. Okay. So that's the basic thing, right? Okay. If we get to a point that we know the nerve is injured, it's irreversible injured, it's not going to recover on its own, then we do nerve grafts. So I can move a nerve from one part of the body to repair the one that is injured and get it to grow.
The spare parts again?
Spare parts, yes. So, yeah.
Do you use, because I know WAISS is big on minimally invasive surgery.
Correct, yes.
Do you use those techniques for dealing with facial paralysis?
We do.
Okay.
We do. So we know the map of the nerves in the face. So sometimes we make incisions in front of the face and we can go underneath the skin and find the nerves and connect them out under a microscope. Sometimes we will make tiny little openings, 3 millimeters on the skin, and go through it and get straight to the nerve without having to open the whole face. So we have kind of ways to get to every part of the face.
What do nerves look like?
Nerves look like strands.
Like hair?
Like spaghetti split into like 10 times.
Oh, really delicate.
Very delicate. They start a little bit big and then they become smaller and smaller till they get to where they are supposed to.
And do they move when you're looking at them?
Unless I wink at them.
So, and then after the treatment, what next?
So you connect nerves, right? And the nerve starts growing. Nerves grow 1 millimeter a day. When I was a child, we tell you somebody had a spinal cord injury, it won't grow because nerves don't grow. Nerves do grow. So we connect them and then we tell them where to go. Okay. So they grow 1 millimeter a day till they get to their target, which is the muscle. So once we start seeing the muscle movement, then we start physical therapy to strengthen them. And usually people do well.
How often do you have facial paralysis cases in Ghana and Bell's palsy cases as well?
So in Ghana, it's common. So this week that we've been here, I think I've seen 2 people. Okay. In my practice in the US, it's the probably most common thing I do. So I would see probably 40 people on a given clinic.
In a week?
In a day. In a day.
40?
40, yeah, with paralysis. They come from everywhere to see me.
Yeah,
so it's a skewed practice. And I don't think the incidence, there's anything so strange about the US versus Ghana. So I think the incidence will be about the same.
Okay. So now to help with like speech, with eating, with emotional well-being, what kind of support services and therapies exist? You can't give therapy to a muscle that doesn't have a nerve. So once we can get the nerve to get back to the muscle and muscle moves, then we have speech therapy, we have all kinds of devices to help. There are people, physical therapists, who specialize on the face, and they are the ones who are really good. Now, because of artificial intelligence, AI, we have devices that can scan your face and scan multiple normal faces, and then we can use that as a physical therapist for you. We load it on your phone, and the phone will help you be your physical therapist. In what way?
Oh, it gives you feedback. Okay. So you're looking at it, it tells you what to do. Okay. It can record what you're doing, so it can tell you whether you have to strengthen this muscle or that muscle.
Let's talk about misconceptions. What are some of the common misconceptions and myths people have about facial paralysis and those living with it? Okay.
The one thing is that it's been so long, I was born with it, there's nothing that can be done. Even in the US, that's the first common thing that makes people cry when they see me. Because if they've lived their whole life with this and they come and see me and I said, well, yes, we can fix it. So one major misconception is once a nerve is injured and your face is paralyzed, nothing can be reversed. That's not true. So if we see you early, we can repair the nerve. If you come late, we have to transplant the muscle. So that's the major misconception that we want to wipe off. So we've talked about paralysis, right? Paralysis in the sense is that a muscle is not talking to the brain, so it doesn't have any impulse. It's like you have a bulb and a switch, electrical wires, and the circuit is not communicating to the bulb, right? So that's paralysis. You turn the switch on, the light doesn't come on. Okay. So you can have paralysis in any part of your body. Now, there's something called sleep paralysis, and there's something called sleepwalking. There are people who walk during the night and eat food, and they don't know how they got there. They'll come back and sleep, right? Sleepwalking. There's also sleep paralysis, narcolepsy. You have so much sleep disorder that at night you cannot move.
You're trying to move and you
cannot move.
It's terrifying.
Yeah, it's terrifying. It's a transient thing. It's a temporary thing. That is totally different from paralysis with a nerve that doesn't work.
It's not a spirit that is holding you down.
You know, we live in Africa.
You know what we believe?
The spirits are very powerful. Yeah, but that's a sleep disorder. Okay. If you get those things often, you should have an evaluation by a sleep specialist. Okay. Interesting enough, WAISS is setting up a sleep lab. Good. And to look into some of these things, because really, when you sleep well, your brain rejuvenates and you're able to do the tasks for the day. I think sleep is underrated. Like, the importance of sleep is underrated. There are a lot of people in this country that I know snore a lot. When you snore, it's just the tip of the iceberg. It means that during the night, the air doesn't get down. So you stop breathing, your brain wakes you up. So you will sleep 9 hours, and you wake up, you say, I'm still tired. You probably have a sleep disorder. We should check that out for you.
So narcolepsy is a sleep disorder.
Yes.
When you open your sleep lab and you need subjects to study sleep, please, I'll come and sleep and then you study me.
Wonderful.
Yeah, I'm a
Wonderful.
willing subject.
Excellent.
Just share with us some of the surgeries you've done that have brought so much joy to you and kind of changed people's lives just from the magic in the room.
So many, but one comes to mind. When I first started practicing in the US, I was sent a 2-year-old with paralysis. They had gone to multiple major institutions in the US, and nothing could be done. He was born with a tumor growing on the nerve. So he was getting twitches in the face. We call it a neuroma. For a 2-year-old, it was very uncommon. And if you take the tumor out, the face is going to go out completely. If you don't take the tumor out, it will continue to grow. So when they came to see me, I said, well, I think we can bypass the tumor. We do a bypass. When we say a bypass, we think about bypass for hearts, right? But for the face, I said, I think we can bypass the tumor by moving things around.
But how would that work? I mean, the problem is here.
Yes.
And you want to bypass it.
Bypass it.
Are you not avoiding it?
So as long as you can get an impulse from the brain to get to the muscle, you can get the brain to communicate with the face and it will move, right? Now, the tumor is in the brain and it's not an easy place to go and take the tumor out and sew a nerve. So what I did was I took another nerve that I know moves muscle and then I connected it in front of the tumor. So let's say one of these highways to a brewery is blocked, and I will go through Medina and connect another nerve
around
and come around.
Get to a brewery.
Yes. So that's what I did. So bypassed. And when the kid was about 6 months after the surgery, I got an email around 4 a.m. in the morning, right? And when you get an email around that time, it's not a good email. No. Yeah, from your patient's family. Yes. There's something wrong, right? But this one was a father asking me to call him right away, 4 a.m. So I called. And he lived in Kansas. And he was like screaming on the phone. He's smiling. You know, it was the first time in his child's life that the child has smiled back to him. Like he went to his room and the child was smiling back. And of course,
which means the nerves are working.
They're beginning to work.
Yeah.
So one of the things about facial paralysis, you do the connection, you don't see the result right away. It has to grow, right? And I could feel the joy in his voice, like distance away. Yes. It was the way of starting my career. So that's one of the memorable stories. That kid, when he turned 18 years old, sent me a video telling me that he's making it to college, one of the elite colleges in the US. And you can imagine how that made me feel.
Yeah. Smiling all the way to the college.
Yes.
I'm just wondering about the tumor, because if you bypassed it, did you leave the tumor there?
So I bypassed it and allowed the nerve to grow into the face to allow another surgeon to take the tumor out. So once we had this new connection, then we can take
it's like a new road going to a different place.
Correct.
And now you can deal with
unblock the traffic.
Good job.
Yes. Yes.
Let's talk a little bit about WAISS. This is the West Africa Institute for Special Surgery.
Yes.
What's the big idea?
Okay, so, you know, Ghana has produced a lot of brilliant people. Some of them are here, some of them went out, and they are doing magical things. But our hearts are now in two places, right? And we come home. So we just finished a surgery taking a brain tumor out, right? That's what we're doing. I have seen people with that same brain tumor that I take out in 2 hours and they're fine, but in Ghana, they go blind because that tumor grows and pushes on the nerve that they see. It doesn't sit well with us. So how come we are just separated by a plane flight and the place that we were born cannot get that type of expertise?
Well, you're helping other people elsewhere.
Well, we are helping other people elsewhere, right? It doesn't add to our success. So a lot of us said, you know, we want to bring our skill set home. It's sort of a blow to me when I hear Ghanaians having to travel to India to get the kind of care. When I know the Indians come to me to get a care, and they come to my partner doctor or come to get a care, right? We want to tell people that we can give that level of care right here. And so that's the vision behind WAISS. Now, they said if you don't pass your skill set to anybody, your skill set dies with you. Like a river that doesn't flow stinks. Right? We have a lagoon in town. Yes. It doesn't flow, stinks, right? So you have to pour yourself into someone else. One of the ideas here is that we want to pour our skill set into younger people, train them, so we can sit back and make this sustainable. So that's the idea about WAISS. At WAISS, almost anything you can think of specialty-wise that requires surgical care, if in the things that we're doing, we can do it to the highest level. And you're big on minimally invasive surgery? Yes, we don't want people having protracted recovery. So anything that we can do with little cuts, with cameras, even with a robot, so that they can be on their recovery and back to life, that's what we want to focus on. Good job. Thank you very much. And finally, what words of encouragement would you give to someone who is living with facial paralysis? You know, we are our face, but we are more than our face, right? And the point is not to lose hope that there is nothing that can be done. If someone has had facial paralysis, either they were born with it or they acquired it, they should come see us. We'll offer them some help. Thank you so much, Doc. Thank you very much. It's a real pleasure. And hopefully you've learned a little bit more about facial paralysis from facial plastic and reconstructive surgeon, Dr. Kofi Boahene at the West African Institute for Special Surgery, WAISS. My name is Kafuide. Keep watching GTV Breakfast and give you a big smile.